Hi, everyone, and welcome to Mental Health Matters. Today, we are talking about strategies for supporting mental health in youth and teens. At the end of this presentation, you will have an opportunity to ask questions, so please feel free to enter your questions in the Q&A box at any time throughout the presentation, and we'll do our best to answer as many as we can. My name is Bethany Bruin, and I am the occupational therapist on the subject matter expert team here at Autism Ontario. I'm joined today by my colleague, Danielle. Danielle, would you like to introduce yourself?
Hi, everyone. I'm Danielle Nolan, and I'm the social worker on the subject matter expert team.
Thanks, Danielle. So today's presentation, as I mentioned, is focused on strategies for teens, and here's a brief overview of what we will be discussing. We'll review and discuss some lifestyle strategies, and we'll be talking about a strategy called collaborative problem solving, or collaborative and proactive solutions. And then we'll talk about some brain and body strategies, including sensory strategies, mindfulness, acceptance and commitments therapy, and cognitive behavioral therapy. And finally, we'll review some creative art strategies. So as we mentioned, we'll be talking about several different types of strategies. For example, we'll be talking about lifestyle strategies. And these are strategies that can help to support your whole family's mental health. So these are things that you can try together if you seem like they would support your family. On the other hand, the brain and body strategies might be more applicable to your autistic teen, and you may want to trial some of these with your teen a few at a time. It's important to note that as you're trying these different strategies, it's helpful to keep a record of what strategies you try and what the impact is. If you have access to a therapy team, they can help you to collect this information on whether a strategy is working and how to adjust or change that strategy to try something else. If you don't have access to a therapy team, it can be helpful to use a journal or keep a record of how your child is doing before you try a strategy and notes on what it looks like after you try a strategy. Keep in mind that change can take time, and sometimes change happens in very small steps, a little bit at a time. So just remember to be patient with yourself and to be patient with your team as you work through these strategies together. So the first set of strategies we are going to address is what we are calling lifestyle or environmental strategies. You might remember that when we're talking about mental health, we're talking about our thoughts, our feelings, our behaviors, and how we respond to stress or challenges in our day-to-day life. Stress or challenge can look different for everyone. It might look like something that's happening around us in our environment, maybe a loud sound. It might be learning a new skill, maybe a new school skill like math, or a life skill like packing a backpack. Stress or challenge might be a change in our normal routine, like a family vacation or a school field trip. Lifestyle strategies are things that we can put into place throughout the day and from day to day to increase those feelings of safety, security, and predictability that help our brain to feel calm and regulated. These might include having a predictable schedule, so we don't have to do the exact same thing at exactly the same time or in the same order every day, but we have generally a flow and a structure to the day without a lot of new challenges. Using visuals to support this schedule can help us to communicate clear expectations and if there's any changes in our schedule. This might look like using a family calendar, a school agenda, or a daily scheduling app. Again, the purpose of keeping things predictable is that we want to limit the amount of surprises or changes that our teen may perceive as stressful. If we want to look at some more examples of lifestyle strategies, we can consider how we're planning our daily schedule. Ideally, we want to aim for a mix of high and low energy activities. So for example, when we have a flow to our day, we want opportunities for movement and exercise, times to go outside, maybe going on a family walk. And we also want to balance that with times for calming and soothing and collecting type of activities, maybe listening to music together. We want to look at how we're managing transitions, or those times when we're switching gears from one activity to the next. So we want to offer clear communication. Maybe we're giving a 5-minute warning before we switch from one activity to another. And we want to plan ahead for those transitions so that we can have strategies in place. Maybe it's by scheduling a favorite activity so that it happens after screen time, which gives your teen something to look forward to when it's time to put away their device. On that note, we also want to think about screen time and technology and how it may be contributing to our child's ability to stay regulated throughout the day. Research shows that autistic children are exposed to more screen time than their neurotypical peers. And corresponding research also shows that increased screen time can be associated with an increase in both internalized behaviors, things like anxiety, and externalized or challenging behavioral concerns. We know that screen time is inevitable in our culture. We want to be mindful of the amount of screen time we're giving our teens, as well as paying attention to the type of screen time. So an example would be watching a movie as a family or FaceTiming with a friend can be a very different type of screen time than maybe playing a video game. We can look for quality sources of content and do our best to engage with our teen when they're interacting with screens. And finally, we want to do our best to track the length of screen time. The Hospital for Sick Kids recommends that children and teens up to age 17 have less than 2 hours of screen time per day. Now we're going to talk about an approach called collaborative problem solving, or collaborative and proactive solutions, that was developed by Dr. Ross Green's team. Although this model wasn't developed specifically for autistic or neurodiverse youth, research shows it can be an effective way for reducing problematic behaviors and improving outcomes. In this approach, we're working together with our team to solve a problem. When we're problem solving, we're figuring out what's wrong, what's bothering us, what's not working. That's our problem. And then we want to come up with ways to make it better or fix it or make it work. That's our solution. In this approach, we start by gathering information and thinking about what our problem is, what's wrong, what's not working. And then we're working with our team to define each of our concerns. As a parent or a caregiver, what are our needs? What are we worried about or unhappy about or concerned about? And then we talk with our team about what their concern is. What are their needs? What are they worried about or unhappy about or concerned about? And then we do our best to come up with a solution that meets both of our needs, and we can try it. The important part to remember here is that we're working together, collaborating about an approach or solution that might work for both of us. And developmentally, teens are seeking that independence and control. They want to be part of the discussion. This can become an ongoing discussion. If you try one thing and it doesn't work, you can always try again with a different approach. Autism Ontario partnered with Dr. Ross Green on a webinar about challenging behavior that uses this approach, and it can be found linked here in your resource section. So next, we are going to switch from lifestyle strategies to talk about some brain and body strategies. Sensory strategies can help teens stay calm and self-regulated in order to focus, attend, listen, and participate. We often talk about using sensory tools for younger kids with examples of things like tangles and poppets, those types of fidgets. But for teens, they can be more subtle, like a scrunchie or a pen that you can click or spin. And they can also be strategies for reducing sensory input, like wearing headphones. Lots of teens like to block out noise so that they can focus when they're trying to accomplish a task. But autistic teens may also benefit from using sensory headphones as a way of regulating and calming. Other sensory strategies include self-stimulating behaviors, or stimming, as a way of increasing sensory input. You can support your teen by normalizing their need to access sensory tools or to stim, as well as to problem solve together about ways they can meet their sensory needs, perhaps with the support of an occupational therapist or another professional. Autism Ontario has a great resource about stimming that explains what stimming is and when or how we may want to support our teen with stimming. Again, it is linked here in your resource section. And now I will pass it on to Danielle to review some mindfulness strategies with us.
Thanks, Bethany. The next brain-body strategy we want to talk about for teens is mindfulness. Mindfulness is an approach to mental health where people are trained to pay attention to the moment and bring awareness to their body sensations, feelings, thoughts, and senses. For autistic teens, mindfulness exercises, including yoga, have shown to benefit social and emotional well-being, as well as externalized behaviors. Yoga, meditation, and mindfulness breathing exercises all involve taking deep, controlled breaths that bring more air into the body and help calm your body and your nervous system. One type of mindfulness exercise that can benefit teens is a grounding technique. Grounding techniques help people reconnect with the present moment and focus on the sensations in and around them. This grounding technique, called 5-4-3-2-1, is very common, and your teen is directed to bring their attention to each of their 5 senses. Not every teen will benefit from identifying each of the senses, or they might not need all 5 every time. For example, they may focus on 5 things they can see and 4 things they can touch because hearing, smelling, and tasting only increase their stress. Be flexible and listen to what your child needs most. You're the expert, and so are they. There are many different mindfulness strategies that you can research on Pinterest, and our resource list, we've included a bunch of different ones. Specifically, there's the Positive Psychology website that offers a whole list of activities, including apps and YouTube channels that you can explore for your teen. Mindfulness has also been shown to improve the stress of caregivers like yourselves. Last year, we put out a resource called Caring for the Caregiver Guide, and it included information on mindfulness for caregivers. We've linked that to your resource list as well. If you start to look for therapy or treatment options for your teen's mental health, you're likely to come across acceptance and commitment therapy and cognitive and behavior therapy that we are going to talk about next. Acceptance and commitment therapy, known as ACT for short, is a newly emerging field of practice for working with autistic individuals and their families. The idea with ACT is that people embrace their thoughts, their feelings, and their experiences rather than fighting them. You commit to facing the problem head on and then use both behavioral and mindfulness strategies to work through it. Research shows that ACT can both benefit your mental health outcomes and adaptive skills. So these are things like social skills, organizational skills, and activities of daily living. This image is clipped from a workbook called Helping Autistic Teens to Manage Their Anxiety, Strategies and Worksheets Using CBT, DBT, and ACT Skills by Teresa Kidd. It shows an example of trying to hold a beach ball underwater. ACT is based on the idea that you cannot hold your emotions down or hide them forever. Just like with the beach ball, it can be exhausting and frustrating, and eventually the ball will pop out of the water. ACT helps teens to accept their emotions and begin to feel comfortable experiencing the full range of the human experience. And this includes difficult emotions like worry, anxiety, and sadness. ACT also involves being on the same page as your teen, understanding that you and your teen need to have similar goals and similar values so that it can be valuable to spend time chatting together, helping them find out what pieces of their life are important and what things they'd like to work on. ACT is often done in therapy with a qualified mental health provider, so I do encourage you to reach out to providers in the children's mental health community. In the meantime, if you're interested in learning more, there are some online resources that might be helpful. This book mentioned here is one example, and it's linked on your resource list if you want to learn more. Next on our list is cognitive behavior therapy, known as CBT. CBT is the most commonly researched therapy technique for mental health concerns in the autistic population. CBT treats anxiety symptoms by using behavioral strategies, such as exposing the individual to their triggers in a gradual way, as well as cognitive strategies aimed at challenging thoughts and feelings. The idea is that the way we interpret an event impacts on how we feel about it and thus how we respond. This is another example from the book I mentioned previously. In this example, an event happens where someone misses the bus. The interpretation or the thought is that they're going to be fired for sure. And the associated feeling is panic with a pounding heart and shortness of breath. And then the behavior is to give up and go home. CBT would include strategies to help address the unhelpful thoughts or interpretations, as well as the behavior. CBT is another technique that is best done with a qualified mental health professional, but like with ACT, there are some online resources that you can check out to understand more about CBT. We've linked a few to your resource list as well. Last on our list are creative arts therapies. Art therapy aims to improve self-esteem and coping skills and minimize stress, and it includes all types of the arts, including drama, music, dance, photography, and the visual arts. You can access formal art therapy if that's available in your community, but it can also be beneficial just to enroll your teen in an arts recreational program. Autistic teens sometimes struggle to express themselves, and art can be much less stressful and more motivating and easier for them to do so. Art is also a proven relaxation technique, and it allows your teen to connect with themselves in a very non-threatening way. My advice to you parents is to explore what your child enjoys and to encourage it. Building self-esteem and experiencing joy are strategies in themselves. There are many different strategies you can try at home, including journaling, mandalas, taking pictures, or drawing or sketching. If you're looking for more information on creative arts therapies, we recently put out a guide that outlines the various modalities. It's on your resource list too. Abigail Balfe is an autistic adult who wrote about her experience as a teen and young adult with autism. In her book, A Different Kind of Normal, Abigail writes, "The word autistic is not placing limits on my abilities. It's giving me permission to continue to be as different and as creative and as genuine as I can be, knowing that is who I was meant to be in the first place." If you're interested in Abigail's book and other resources by autistic people, they can be found on your resource list. We encourage you to continue to read and learn to better understand your autistic teens' experiences and how they might be impacting their identity, self-esteem, and well-being. As we mentioned in our introduction, there are 4 parts to this mini-series, and 3 of these focus on each specific strategies. If you missed watching any of the sections, the introduction is available now on demand, and the others will be added shortly. The link is here on the slide if you're looking to access the others.